Hello, I'm Janna Champagne, autism mom, United Patients Group medical advisor, and patient advocate, here to answer your burning questions about cannabis for autism. Today's question is, how much CBD should a child take? The answer is that optimal dosing titration of CBD is very individual and dependent upon many individual factors, including severity and length of illness or endocannabinoid deficiency. The best approach is low and slow titration to find an individual's sweet spot, which also prevents using more CBD than is required to manage symptoms effectively. While there is no risk of overdose with CBD, it may interact with concurrent pharmaceuticals, and if taking them together, it's important to seek screening and guidance to reduce this risk. United Patients Group supports the use of Unity Formulas CBD for targeting autism in all forms and offers a coupon code UPG15 for a 15% discount off of your Unity Formulas purchase at www.unityformulas.com. To learn more, please check out the links on this page, including my research-cited articles and videos explaining the science of cannabis for autism. If you need even more assistance, including screening of pharmaceuticals, I also encourage you to click the Book a Consultation link and schedule a session with an autism-knowledgeable United Patients Group cannabis nurse. Be informed and be well.